Hi everyone, welcome. I think we have all of the panelists ready in the webinar. Yeah, depend on your time zone. Good morning, good afternoon, good evening, and good night maybe. My name is Trisa Silestari and I'm the TDR Global Focal Point for Asia, based at the Center for Tropical Medicine at Universitas Gadjah Mada in Indonesia. And it is my pleasure to welcome you to today's webinar on research mentorship. We are very pleased that you are able to join us in the first installment of TDR Global Asia webinar series. And just to take a moment for those of you not familiar with TDR Global, TDR Global is a worldwide community of scientists and experts who have been working with TDR on research on infectious disease of poverty. So this is actually a growing global scientific community from different background, different generation, and everyone have a unique expertise. And we want to connect members that share a field of interest, connect established researchers with young researchers, and build collaboration. If you go to the TDR Global website, you can find a short video explaining what is TDR Global community that you can watch on the TDR Global website. And I'm really excited today that we will listen and discuss about research mentorship with you and also with our panelists, because mentor plays key roles in my life, and I always very grateful for them. And I know that this is not something that you can get easily. It is not something that you ask somebody to do, like meeting an expert in a conference and then ask them, can you be my mentor? Sometimes it doesn't work as simple like that. So, but it is a classic way to find a mentor. It's by finding someone who is working in your field or expert or senior in your office, and then you spend time, get along, and then you develop trust. And then when you have problems, you go find them or email them, and they will always take the time to respond to your question. You repeat this process, and over the course of time, you will find a mentor. But in reality, this is not easy because capable mentors are usually very busy, and they also have a limit on how many mentees they can take care of. And it's also like a relationship. Like you might find a very good mentor, but you might not get along with them. And also distance also plays a key role. So we need an innovative approach for mentorship, how to find a mentor, and if you are an expert in your field, how to provide guidance to those who really need your expertise. So enhancing research mentorship is a priority for TDR Global, and we want to engage TDR Global members like you, as well as young and established researchers who are maybe currently not joining the TDR Global members, especially those living in low middle income countries, to generate ideas and improve research mentorship. Last year, TDR Global is collaborating with the Social Entrepreneurship to Spur Health, or SESH, to create a research mentorship contest. And on this webinar, we are going to hear about the experience and the outcome of this contest. And today, we are delighted to have with us two experts from SESH, Associate Professor Dr. Joseph D. Tucker and Professor Weiming Tang. Dr. Tucker is an infectious disease physician with a special interest in using public challenge contests to improve health. He is an associate professor at the London School of Hygiene and Tropical Medicine, associate professor of medicine at the UNC Chapel Hill, director of UNC Project-China, and chairman of SESH Global. So we will hear more about SESH and research mentorship from him. And at the second session, we will have Dr. Weiming. He is a professor at Dermatology Hospital of SMU and assistant director of University of North Carolina Project-China and director of SESH Global. So he is very much involved in the TDR Global Research Mentorship Contest. And we will hear more about the contest from him, how it was done, what is the result, and what is the next step. And we're also very happy to have two finalists of the TDR Global Research Mentorship, Dr. Ezra Valido. He is a PhD candidate at the University of Lucerne and the Swiss School of Public Health. Ezra is from the Philippines, and he managed a community of practice on implementation research with his colleague in the Philippines. And our second global finalist is Dr. Christine Boynet. She's the research mentor finalist from Europe. She's currently the principal bioinformatician and product manager at Wellcome Sanger Institute, but today we will hear from her about her project on Digital Mentor podcast. So this is our webinar agenda for today. We will have about 1 hour to discuss about research mentorship. And after our panelist presentation, we will have a quick question and answer session. But you don't have to wait until we completed all presentation. If you want to ask, you can use the question and answer box or share to ask questions to the panelists or to share your ideas during the webinar. But before we begin, I'd like to run a quick polling about your role in mentorship. So we have 3 questions here. So this is the first question. Are you currently involved in research mentorship? So you can click yes or no. Almost half of participants already vote, so so yeah, I think we don't have any more vote. So now you can see the result. It's quite interesting. It's very mixed. Almost half of you already involved in research mentorship as mentor or as mentee. 1/3 is both as mentor and as mentee. So it's very interesting. 40% of you also have another mentor or mentee living in another country. So this is very interesting result, and maybe, yeah, maybe Dr. Joe Tucker, you can discuss later in your presentation. So without further ado, I will turn this over to Joe. Joe, for those who missed the introduction session, Joe is the chairman of SESH Global. So over to you, Joe. If you need to share your screen, you can do it.
Thanks, Dr. Lestari. It's great to be here. And do you want me to share video too, or no? Or no?
Yes.
It said the host has stopped it. Maybe can you change the setting?
Okay, wait. Just wait a minute. Can you
And
share?
while we're waiting, yes.
Okay.
Thanks so much, Dr. Lestari, for the invitation to come. It's really a pleasure to be with you here today. And I guess before I get started, this is totally informal. So if people have questions, feel free to raise your hand or put anything in the Zoom chat. And I do see that there's a hand raised, Duong Hong Chuan. Do you have a question? If you do, feel free. I don't know if they can, let's see. I will allow you to talk. You're now unmuted, Duong Hong Chuan. Do you have a question? Maybe not.
Maybe not yet.
Okay. If you do, feel free to put your question in the Zoom chat. Thanks for the great introduction, Dr. Lestari. I think it's fantastic that your regional training center has organized this. This is such an important topic. So research mentorship, so many times we forget about mentorship, right? It's the last thing, as you have all the lists of things to do and check boxes and sort of grants to write, papers to write. Thinking about cultivating research mentorship is often forgotten or neglected, that it can be difficult to find funds to support research mentors, that, as Dr. Lestari pointed out, a lot of times it's a fit. It's sort of like, is there a click? Is there sort of chemistry or magic between two people? And is it the right sort of mentor and the right mentee? And so what I'll do is talk a little bit about my own story and sort of how I found my research mentor, and then also provide some open access resources about research mentorship and sort of suggestions for further places. But I'm not going to talk about the contest. Dr. Tang is going to do that, and Dr. Boynette and Dr. Valido will have give us more specific examples. But so just in terms of research mentorship for me, I started to study Mandarin Chinese as an undergraduate, as a university student. I loved Chinese. It was fascinating. And I went and sort of found an American doctor who had spent a lot of time in China, Mike Cohen. And it was part of, as part of finding him, I said, I want to do HIV research in China. And he said, Joe Tucker, you're totally crazy. You have no medical training, no public health training, and your Mandarin Chinese is very poor. And he was basically right on all accounts. At that stage, I had very few skills, but I did have a lot of enthusiasm. So Dr. Cohen sort of took me under his wing and said, look, here's a pathway. You go to medical school, you do more training. And he's been an amazing mentor, not just in terms of suggesting formal training opportunities, but introducing me to other colleagues, being a champion, and this includes when the things that he's most passionate about are not exactly the ones that I'm most interested in or passionate about. But he's been an amazing mentor for me, and I think provided an incredible example of what mentorship can do. And I think, as Dr. Lastari pointed out to begin with, mentorship is often sort of unpredictable or hard to manage. That sometimes we have mentors in our lives who provide really helpful advice, and it's not something that we could have predicted before. But I do think, in terms of being a good mentor, there are lots of habits and tendencies that we can cultivate to become better mentors, being more self-critical and thinking about how we can lift up the next generation. So that's and I see a couple of hands raised in the chat box from Kira and Duang. I'm happy to allow you to talk. Kira, do you have a question?
Yes, please. If you have a question, just
hello. Yes, yeah. I have a comment.
Sure, go ahead.
I'm a professor of global health and infectious diseases and a staff member of TDR, and I have a past experience of being a WHO officer in Jakarta 10 years ago. So I was doing HIV/AIDS and blood banking, and I was at that time involved in developing a research methodology group across 8 universities in Indonesia. And as WHO, we funded it, and we were having monthly meetings across, and we of course went to Gajah Mada and as well as Bali and Jakarta universities. And we created, over a period of 1 year, for tropical, neglected, and of course infectious diseases, a group of experts who would mentor young investigators, especially the ones who were getting through the postgraduates as well as young faculties, and spend 2 days looking at the submitted proposals or the completed research proposals, and then go over half an hour, 45 minutes. So it was more like hands-on kind of a mentorship by a group of 8 or 10 senior faculty, both from the WHO as well as the Ministry of Health and the universities. And it worked pretty well. And that time it was the subsequent Minister of Health, the lady who was along with us at that time. And I remember that it was a very, very positive, very productive experience with Indonesia. And I was going to actually suggest that irrespective of, now I'm at the University of Washington, Seattle, as well as spent time living in Mumbai after having retired from WHO. But to come to the point of mentorship, and especially in research, and we know now that there are international changes, geopolitical changes that are happening, and I was going to suggest that irrespective of whether the program at Gajah Mada, it's a great university. I was almost there every quarter, the years I lived there in Jakarta. And it's people like us can actually help bring in the technical attachment or long distance mentoring to young, good investigators at the Southeast Asia region. Investigators coming up want us to have a look at your proposals or your research questions, help you develop methodologies, help you develop suggest what kind of analysis and interpretations can happen. I mean, it's something that we can put in a smaller number, and together with people back in TDR in Geneva as well as other places, we can and we understand we won't be paid for it. Fine, it's the kind of thing that we can do long distance, and I think it's going to be long distance for a while till this whole COVID thing is sorted out. I'll stop here so that I don't consume too much time, but if there are any contributions or any questions along this, please let me know.
Thanks, Professor. That's a great suggestion, and I think it would be definitely worth following up on this and sort of cultivating mentors that, especially in our COVID universe right now, identifying digital mentors and linking people up is really important. So that's a great idea. I just wanted to call out a couple of open access resources and groups that are really interested in mentoring. So one is the US NIH Fogarty International Center, and I'm going to put the web link in the chat. Basically, this is the part of the NIH that focuses on global health training and capacity building, and they have there are sort of specific short-term training opportunities. There are medium and long-term training grants that some groups might be interested in, and if any groups are interested in applying for a training grant, I'm happy to provide more details. Our group received a D43 Global Infectious Disease Training Grant from Fogarty, and it was really it was an important part of helping to build training within our research team. So Fogarty is definitely a group that people interested in mentorship and training should know more about, as is TDR. So Dr. Lestari mentioned TDR Global, and that's part of TDR, which is really focused on infectious diseases of poverty and capacity building and training. And so TDR also has a special interest in promoting mentorship. I think it's a really valuable resource. There are grant applications and also specific programs, just like the one that Dr. Tang is going to be talking to us about now. But I'll stop for now. If anyone has any questions, I'll be on the web chat and continue throughout the hour. Thanks again for organizing this, Dr. Lestari. It's really a pleasure, and I'm glad to be part of this, and I'll hand things over to Dr. Tang. Over.
Yeah, please. Thank you, Joe. And Dr. Weiming?
Yes, I'm here.
Yeah. Do you want to share your screen or?
Sure. Well, yeah. Let me share my screen with you. Can you see my screen?
Yes.
Okay. Let me. Sorry, give me a few seconds. I don't want everything to interrupt us. Okay. Thank you, everyone, and thanks, Dr. Lestari, for this opportunity, and thanks Joe for introducing this mentorship to a group of people. Today, per the request, I will present things regarding a contest regarding mentorship that we collaborate with TDR Global. This is also like a research mentorship contest. We conduct this contest with TDR Global in the last year. The idea is actually to solicit input regarding how to improve research mentorship in our MLC and on infectious and poverty. As you know, enhancing research mentorship is a priority of TDR Global, and this this challenging contest is actually to solve the problems. This contest was actually collaborated between TDR Global and SESH Global, with the support from 3 TDR RTCs, which are Latin America RTC, Africa RTC, and Asia RTC. We did get lots of support from Dr. Lestari from the Asia RTC side, because all the promotion was actually conducted by the 3 RTCs, except the global announcement. For the contest, many of you may not know cross-sourcing contest. The cross-sourcing contest is a process of strategies to collect ideas from a group of individuals to solve a certain problem, and then share the solutions with the individuals. So we want to use this cross-sourcing contest to collect inputs from the TDR global families. So the contest was created in English, and then was translated into Spanish and French, and then share with TDR Global Network. We also posted we created a website for this. I think Joe just shared the website with you in the chat box. Also, this contest will consistently promoted through different social media platforms. We also promoted through institution and community advertisements by different regions, especially from the Asia, Africa, and Latin America RTCs. In addition, in order to engage more people from the TDR Global family, we actually send an email invitation to the people who already registered as the mentors or mentees of global family networks of TDR Global. We send them a short message and ask them whether and encourage them to submit their interest through our website. For the website, we created a website, and the website was viewed by about 4,200 times by 300 unique viewers. Most of the people are from the US, Indonesia, China, Colombia, India, Ghana, and also other countries. So, and at the end of the day, we actually received 123 submissions from 40 countries. There are 49 submissions are from Asian countries. I think most of you, some of you may already submit interest to the cross-sourcing contest. If you have submitted, I would like to say thanks to you. Thanks for your participation. We also have 38 submissions from Africa, 26 from South America, and 10 from Europe. Of the 123 submissions, 114 were English and 9 was in Spanish. 64 were male and 59 were female. There was a very good gender distribution for these things. Most of the participants are aged between 20 to 37 years old. I think the mean age is close to 35. 108 participants have the research experience in our MICs, because the one eligible criteria is actually the research mentorship is need to relate to research mentorship in infectious and poverty in our MICs. That's why we said we found that 105 submissions were deemed to be eligible, and 21 submissions received a score of 7 or above. So this typically is the distribution of the submissions. After that, we said, and after we decided the submissions were determined to be eligible, we submitted them to a couple of different judges, both in there are 15 judges from 3 RTCs. We asked each RTC in Latin America and the Caribbean, Asia, and Africa suggest 5 judges. In together, we recruited 15 judges. And then, based on this judging rubric, we sent the the individual submissions to the judges, and each one give their score for each for the submission, and each submission at least received 3 independent scores. We also try to reduce the possibility of conflict of interest, to have if the people submit their entries and they cannot be judged by themselves, or people know them very well. Based on the judging, actually 4 submissions were determined to be global semi-finalists, and further we have a second round global pitch. We host global pitch in June 29th. We have the 4 global semi-finalists present their ideas in webinar, which was hosted on June 29th of this year. Each of the semi-finalists actually gave a presentation on their idea, what's their implementation plan, whether they do have primary data for the implementation, and what's the next step. 3 of them are determined to be global finalists, as you know, due to the inclusion criteria. All the submissions need to be relevant to LMICs. And for the next step, we're working with these 4 groups to help them to further implement their idea. We'll have a workshop by monthly. We'll have the SESH and the 3 RTCs to work with them to further implement their idea. These are basically 4 finalists from the contest, which are there was 1 in each region actually. The Latin American is from the group of Anna Maria. It's about idea of community-based mentoring to enhance competencies and development of rural Bolivian research teams. And from Asia, we have the Dr. Izira Avalido's idea got selected as a global finalist. This idea is about small in-country communities of practice groups that are facilitated and motivated by research institutes or by local research organizations. I think Dr. Valido will give more description of his idea into this webinar. For the African RTC, Dr. Asenga, whose James study was actually selected as global finalist. Dr. Christine Bonnier the submission was actually selected as semi-finalists, but not global finalists. We do not actually say that this submission is not good, but per the TDR Global, we only will select the global prize from the 3 RTCs. Although we found that Christine's idea is actually very good, we also wanted them to be selected as the semi-finalists, and would like the SESH team will help them to further tweak their idea and see how to further support her. I think Christine will also share her idea into this webinar. These are all 4 ideas. Will not go in detail in here because Dr. Valido and Christine will share their ideas in here. And other 2 ideas were already mentioned in previously. I also will not go detail in here. If you have any questions regarding this consortium contest or want to know more about this, you can go to the website. We have that Joe put in the chat box. Or if you have any questions regarding to this, I'm happy to answer any questions relevant. Thank you.
Yeah, so anyone have a question about the research mentorship contest? So actually we have a lot of great ideas from participants from Asia. So that's why we invite all of the participants to attend this webinar because I think your mentorship idea is worth to be implemented, and we would like to know how we can support you in implementation of your mentorship idea. So please feel free to share your ideas. But now I'd like to, thank you, Weiming. I think it was a great success, and also thank you for SES team. So I know that it's a big, a great work for you,
Thank you.
and also a huge success. So now I'd like to pass to Ezra, Dr. Ezra Valido, to share his big idea about research mentorship. So for those of you who missed the introduction session, Dr. Ezra Valido is from the Philippines, and he is a PhD candidate at the University of Lucerne and the Swiss School of Public Health. So over to you, Ezra.
Thank you. Let me just share my screen. Okay. There. So, as the could you hear me?
Yes.
Am I clear? Yes.
Yep.
Okay. So, as described a while ago, the idea for the mentorship, the big idea was to really create a small in-country community of practice of people doing research in the Philippines. So I put it in the title for this. It's getting research to work for people, not only for those who would benefit from it, but also to those who would actually do it. So the idea was really based on my own experience as a young researcher. And as I was trained in Indonesia for implementation science, I came back to the Philippines to actually find work and what were the challenges from it. And because I have also friends from abroad who came back who had done their research training as well, this was a more of like a collective problem that we actually faced when we came back. So we had this problem that when you go back from an academic life or from a master's or a PhD from another country and then you go back to your home country, what happens really is if you're not associated with the university, you are faced with a lot of problems. One of this would be your funding for a project or an idea that you might have, or even an access to experts either in the academe or even at the field. So these were the things that I was looking at when I was actually visioning my idea for the mentorship. And how could I actually would have improved my situation when I came back if there were things that I could actually latch on. And of course, when you're doing this, it often, if you don't get this, it leads to frustration, and sometimes you abandon your research interests even at the start. So, and in the Philippines, one of the key problems is research is not really a viable economic option if you're looking for a stable financial adult life. So technically, a lot of people do this on the sides, and I could even say that people, even in the academe, actually have more administrative and teaching workload rather than doing research. So in a way, I was looking for a platform or a solution to these types of problems that we encounter, but mostly focusing on young investigators. So the big idea was to look for a way to actually collate young investigators with a similar team in types of research, and then connect them to a local non-government organization. I was really looking for a more non-academic institutions, because if they actually would be responsible for coordinating, for ensuring development of these young researchers, that could be seen as an added work. So I was looking for a local non-government organization who's already doing research and who has an advocacy to actually develop young researchers. And then I was looking for an organization, a local pool of experts, where there is seamless, where you can get people who have practical experience and academic experience, so that we get young investigators outside the academe could actually have a mentor that has gone through the process of not purely academic pathway. So in such a way, when we band together as a group, then we create this small in-country group of practice. Well, and it's moderated by your research institute or your local organization who has access to a local pool of experts. And what I thought of that is that if you have a group of people, then you have a support group. You could build your network. It could they can critique your research questions, and then you can move forward. So I wanted to look for open-minded individuals who are also interested in the same types of research. And for this situation, since the first quarter of 2020, it really focuses on COVID-19 because that's where the demand for research was coming from. And the operations is really handled by the non-government organization and coordinates with the people who are involved in the process. So there are three components of the big idea. One is the community of practice of the young investigators or any investigators who might be interested. Young at heart would be actually could be involved as well. And those the local non-government organization and then the local pool of experts. So lucky for me in the Philippines, I was able to identify those three. So the first one is the Alliance for Improvement of Health Outcomes. They are a local research organization in the Philippines doing public health researches for the Department of Health in some private organizations. And we have the Philippine Society of Physicians in Public Health. This was a medical society of doctors who had undergone training in public health and doing health researchers as well. And lucky for us in this Philippine Society of Physicians, they are actually a group of people, not only by young public health practitioners, but also some of those who have very good experience already, not only in the academe, but also in the practical side. Some of them are actually previous secretaries of health in the Philippines. So that was, for me, a good organization to actually involve in the project as well. And of course, I wanted to have that group of young investigators. And because it was initiated by me, it was I chose the implementation science as a theme at the moment because that was where my expertise was. And that's what the work that I was doing. And there was a demand as well for this because a lot of people are also looking at implementation research as a theme because of our universal healthcare implementation in the Philippines. So there was demand for research for implementation science as well. So when I created this, I envisioned that we would actually do this type of learning. So first is to recruit people who would love or would want to be part of the community of practice. But I needed to ensure as well that they are able to be knowledgeable and aware of implementation research teams, domains, and theories. So we opened the recruitment to everyone who was interested to implementation science. No restrictions to age, sex, or background. They could be medical doctors. They could be young researchers with no previous background. It's just the interest that we wanted to look at. And then they participate in the full process of this. And this is actually managed by the local NGO. It comes from the process of proposal writing to the problem formulation. So they get involved at the earliest details of the research formulation and up to the research processes that would need it. And technical inputs from peers and local experts from PSPHP. So the proposal was actually seen as well by those who were local experts for PSPHP. So when we did the processes that needs to be done in the project, it would be curated by the organization, the IOISG. So the technical inputs that or the technical expert that we need is also determined by that, and we get them from PSPHP. And then at the end, what our output is that at least we have a group of individuals who have gone through an IR, an implementation science type of project, who understands, who are aware of the themes and domains of this, and we would like to keep them as part of our network. And hopefully they get inspired to do this type of research in their field of work. And we bank on to the key idea that learning in ISG is a learning with an adult. So it's adult peer learning by practice with support system that is provided by the local NGO and the local experts group. And we are building a network of practitioners. So some small wins that we are currently have done, because we have implemented some parts of this. We now have 2 teams for 2 projects. So one project team per member. And the first team is really composed of medical doctors, most probably because I'm also a doctor, and a lot of the people that I invited initially were also doctors. Most of them are public health practitioners at local government units. They had their health units at different parts of the country. And the second is composed of 2 MDs and non-MDs. And if I look at the sex differences, we have actually almost 50, 60-40. So one of the good ideas for this that I'm saying is that we can involve more women, and the women that were involved were even married and has their own occupation. So we are living in different parts of the region. We were forced to, and we are forced to do it mostly virtually because of COVID as well. So we are living in different parts, and if you know the Philippines, it's an archipelago like Indonesia. So we don't usually meet on a daily basis. So here are the current projects that we're doing, and it's mostly based on COVID-19 because that's where the demand for research at the moment is. And recruitment is leveraged basically on learning. We don't ask them that they would get paid for this. It's more of learning the process of how to do a research, especially in implementation science. And funding is not guaranteed, but since we are doing a proposal, we are actually sending our proposals to funders. Our first project is actually under the Ministry of Health in the Philippines already. It's under review. The second one is we're still at conceptualization. We're fine-tuning the research question. And I've also asked feedback, and it has been generally good among participants, especially in the idea of the practice of this research is flexible. A lot of us have work. I'm a student myself. Most of them are actually doctors, government doctors, and we do a lot of our interaction virtually in outside working hours. Very open to feedback, and we work in small group. I do think that is an advantage for us. And non-threatening environment, because the idea that this is the peer learning. When we invite experts, technical experts for the project, it's usually not among us, and it's actually facilitated by the NGO. So among us in the group, we have different backgrounds as well. So one of those who are involved are actually in health economics. Others are, they're heading a provincial level health organization. So we also learn from each other on how to actually improve our research. And we have integrated when we interact, we really went virtual, not only because of COVID, but also of our geographical distribution in the country. And here are examples on the screen of what we have used as a virtual platform, and mostly are free. So you can do this as well to your groups. We are using the Google Drive and Facebook as our usual form of communication. And when we actually ask some experts, they present to us through Zoom. And here is an example of one of them discussing about the theory-driven evaluation. So challenges, we have really good challenges in time differences, especially for me that I'm not in the country at the moment and not a single geographic area. Face-to-face interactions, I would say, would be far better than the virtual, but we're actually maximizing also how we leverage the virtual engagement, especially now that there is social isolation in progress in the Philippines. But I also asked for feedback from experts, and most of them would say that it's fulfilling, but it has challenges, especially when you're trying to interact with people virtually. And it seems like they cannot actually discuss, or there are interactions that are important nonverbal cues in communication that is gone when you're doing virtual interactions, and that has been highlighted as well. And of course, because you have limited time and you cannot you cannot talk at the same time in a virtual platform, that they need to simplify the concepts. And for me, that's actually a very good thing. And because it needs to be simplified for them because these are adult learners, it needs to be a more practical example so that they would actually get what they were trying to learn from this. So at the moment, we're actually running 2 projects, and that has been the first one is at the proposal stage already, and it's actually under review, and the second one is still we're doing conceptualization for it. And so that's basically it. Thank you.
Yeah, thank you, Ezra. So I just want to highlight Ezra's presentation that actually mentorship can be done across countries, because currently Ezra is in Europe, in Switzerland, but he can work with his colleagues in the Philippines, and that it can be started as a small community of practice when young researchers gather, learn together, help each other, and learn how to do it better as they interact regularly through using internet technologies. And our last presenter today is Christine Poinet. She's the principal bioinformatician and product development at the Sanger. But today she will talk about her project on developing digital mentor podcasts. So you may start your presentation now, Christine.
Thank you so much, Dr. Lestari. Before I start, I'll put all the information about the podcast here because in the interest of time, I'll try and maintain my to keep to time as much as possible. So I'll share really quickly. This thank you again for inviting me, Dr. Lestari and TDR Global Asia. I'm really honored to be here. And also for the mentorship contest. Without it, I think the come about and there will be no podcast. And the idea behind the podcast improve research practices through mentorship and ideas of mentorship. I'll zoom through my slides because I do understand we don't have much time. So the podcast is really, it's free, and that's, I think, part of the selling point of this, and it's limitless, meaning also it can be on demand, so you just listen to it over Wi-Fi, and it's just experts, bring experts together so they can talk about mentorship and various other topics that I'll cover really quickly. And so on my slide here, you can see the type of episodes we have, and first and foremost is how to get a mentor. Sometimes it's really, as Joe had mentioned, it's about finding the right kind of relationship, and it usually requires you to have something in common. I think those are the greatest mentor relationships to date that I know of. Some of the other things we'll be talking about is burnout syndrome. One of the things that we're finding also in the COVID and working from home is you end up working so many hours, but you don't realize you're burnt out. So these are the things we want to talk about. And we have an expert coming in who talks about mental health and kind of being aware of your mental health as you work, because it does have an effect. And, you know, I have a personal journey on that I want to share on the podcast. The other things as well is networking is your net worth. Truly, that is really an important thing for us. And we have my really passionate episodes about decolonizing global health. And this was a conversation we had with Joe quite extensively, who's also really is an advisor on the podcast. And one of these things is to just showcase to the world. And again, this is not just a podcast for the Global South. We hope the Global North and our allies can listen to this, because we're trying to showcase what the Global South is doing. There's a lot of talent that we want to show out there. And in that also we'll have an equality or equity and diversity episode. So we talk about science and research in terms of publication and good science from the Global South, and also setting up amazing labs with limited resources, but still doing really, really good science. And we'll have another bonus episode talking about COVID-19 from the global perspective, because I worked in Vietnam for a while, and their success story in succeeding in the COVID pandemic is a really important story that I think the world should know, and not look at the Global South as always needing a leg up. But in fact, there's a lot of talent, and a lot of this is providing access. So we're hoping our podcast can be this digital scope that will bring the world together in our knowledge. I hope you'll excuse me, I'm just going to whiz through the slides. This is our podcast team. We are built of 5, actually now it's 6 women, and I call us, the phenomenal 6. And it's just women that came together, and we're trying to make this podcast come alive. But again, through the help of our sponsors and great advisors. We can be found on our website, and I've shared all the links from there. The website is really long, sorry, but if you search for us with ACSC, which is the Advanced Courses and Scientific Conferences, plus your digital mentor, we're the first thing to come up. We're also found on Twitter, so you can please follow us. Those numbers are wrong. We're not 2 followers. We're up to, I can say, thankfully, 75 followers, and we'll be announcing episodes there. But we also want to start things like by you guys sending us, or people sending us good mentors, and we want to highlight them through Twitter. So we want to have, Mentor Mondays, and we've shared with on our website and also on the links here, and I've shared with you guys is the inquiries email. So you can send us emails highlighting different mentors who are doing really good work, so that people can even get advice from you and how you could be reached. We are on several different platforms. So when I presented to TDR Global, I didn't have all the platforms ready, but we are very much set. We start on the 5th of August. So that will be our first set of pilot episodes. We can be found on several platforms: SoundCloud, YouTube, Spotify, and Apple. And what I like about these platforms is you don't need an account. In fact, YouTube, you just play, and same with Apple and Spotify. So long as you have Wi-Fi, you can plug and play. The other advantage of having a Apple account or Spotify account is, and these are free as well. You can have accounts for free, and all you need to do is play them, but you can also download them over Wi-Fi and listen to them on your commute or as you're doing work or offline as well. So that is the other advantage. We want you to be able to just listen to it whenever you can. Included in each episode will be a description sheet. This is just an example of one of the episodes we have now. It's a teaser episode talking about mentorship and the word mentor and how it differs from teacher, for example. And we'll have in the description box more information and resources shared by our guests and experts, as well as reading that you can kind of follow on from there to give you an idea of more about what the topic at hand we're discussing. And with that, I'll just quickly whiz through and say thank you to so many people that have made this podcast come alive. Dr. Taka, who's on the call, has been invaluable as an advisor and getting us to kind of where we are, and also to our financial sponsors that have made this happen. And again, as I said before, without TDR Global Mentorship Contest, this idea would not have come alive. I'm an avid listener of podcasts. I've learned so much from it. Also presenting, talking to stakeholders. So I really am an advocate for listening to podcasts, and you can do it on demand. So that's pretty much it for me. And I wanted to at least save some time for any questions. But again, the links are on the chat there. So please do follow us and tell people about us, because we want to reach the people that will find this resource resourceful, and also allies. We want them to see that and showcase this kind of talent we have in the Global South. Thank you so much, and I will stop sharing my screen now.
Yeah. Thank you, Christine. It's a very exciting project. And for those of you who are not familiar with podcasts, maybe you can start Googling Your Digital Mentor, and it will be launched on August 5th, right? Or 8th, I forgot.
That is right, Dr. Lestari, on the 5th of August, all the way through till November.
Yes. So you can, starting 5th of August, you can listen to Your Digital Mentor on Spotify, Apple Podcasts, or YouTube. Yeah. And also please follow them on Twitter at mentor_podcast to get the most recent updates on about from Your Digital Mentor. So thank you very
Dr.
much.
Lestari. Thank you.
I think we're now going to open a very quick question and answer session. I think we have time for 2 questions or comments. So please raise your hands if you have any question or comment to our panelists. I think we have one interesting question about if you are working, if you have a non-medical background and then working with mentee or mentor from the medical background, sometimes we have a difficulty. So maybe any of you have experience on it?
I'm happy to speak a little bit about sort of cross-disciplinary mentoring. It definitely comes up often, and I think it's what's interesting in some ways. This is like the edges, the boundaries of disciplines. It's where you have really interesting research going on that doesn't fall neatly into one field or discipline, but sort of crosses boundaries. And so if you're not clinically trained, but then you have a clinical trainee coming in, I think part of it is just understanding the sort of your mentee, what are they looking for, how much time do they have. The clinical trainees that we have, oftentimes they'll get a chunk of time where they're sort of 100% focused on research, but then after they get back into the clinic, it's really hard for them to continue working on research things because of clinical responsibilities. So, and I had put, there's a global health, BMJ global health article, sort of a narrative review about some of these things. I can put that in the Zoom chat too, but I think it's a good question. And I think if you understand think about where the clinician's coming from, what are their expectations, what are they interested in, what are their passions, if you can identify what their unique talents are and sort of really speak to those or amplify those, then you've done a great job. Over.
Yeah, thank you, Dr. Tucker. We have one other question from Basan Joshi to Ezra. So the first question is, how will you ensure for the participation of government body in this project so that this can be adopted by the Ministry of Health? And the second is, are you also involving public health expert for mentorships? Can you respond to that, Ezra?
Oh yes, especially for the projects that we're doing, the one project, the first one that we are already under proposal review. The people who are actually involved there are government doctors as well. So technically, the project was formulated because of a demand from the Ministry of Health that they wanted to know what was happening on local government unit levels, and that's why we responded with that proposal. And those who were involved, those who were interested in that topic, were actually local government doctors themselves. What we're doing at the moment is piloting our tools and also looking at how to disseminate this with government. But also the funder that we're looking for this is actually government. So it was designed and conceptualized with government as our primary stakeholder at the end. And do I participate in? Yes, I actually do. Because the implementation research practitioners in my country are very limited. So for me, I need to also step up and discuss also that. But also training here in Switzerland as well, because I also do translational medicine. So basically, that also helps in actually connecting and actually developing further other theories that we can actually use in the country. But because my PSPHP is a varied field, we have health economists, we have actually social health researchers, epidemiologists in that. What we need in the research, we actually match them with the expertise of our experts in the PSPHP, and then we invite them to discuss with us the project themselves. So that's how we do it. And government, because some of our experts are also government officers at this point. So it's actually because that is the key thing, I guess. Our pool of experts are actually well connected to government. So when we disseminate, they even ask us what's the status of our proposal or the status of our research. So there is demand and there is actually an end user in mind.
Thank you, Ezra. I hope it answered your question, Basan. So maybe this is the last question. Probably Dr. Tucker can respond to this. It's about what makes a good mentor and what skills are required for a successful mentoring.
Thanks, Dr. Lestari. And I think this is it's a really key question that comes up often. And I do think that in many ways, anyone can be a mentor, and there are lots of different specific things that we can do to sort of cultivate mentorship. There was recently a special issue of the American Journal of Tropical Medicine and Hygiene that specifically goes over mentoring competencies for people in LMICs. And I just put a quote from that and sort of the link to it in the chat box. But I think a good mentor, in broad strokes, it's about having a fund of expertise. It's about empathy. It's about sort of staying on top of the literature. It's about service to your institution and your professional societies. So there's a lot of different parts to it. And I think it's also iterative, that we often are mentors for people at different stages. And so it's not something to back away from or hesitate, but really to embrace and think about how we can do a better job of mentoring. Over.
Yeah, thank you, Dr. Tucker. I think in the interest of time, that is our last question for today's, but don't worry, because we will have several other webinars, and maybe we will discuss more about research mentorship and maybe creating some programs related with research mentorship with you. So we will follow up this webinar through email. So thank you very much. I think we have excellent speakers and participants. I want to thank all of the panelists, the participants, Center for Tropical Medicine at the Universitas Gadjah Mada, and the TDR Global for facilitating this webinar. And also thank you for your interest in research mentorship and for participating in this webinar. I think every one of us can or will be a mentor at some point of life, and we hope we can be a good mentor by learning together. So thank you very much. Stay safe, stay healthy. Bye-bye.